there. Again, this is the fourth session of discussion group for REALD and SOGI implementation in APAC on June 11th. Thank you all for joining us. This is Karen Hampton. I work for the Oregon Health Authority with the All Payer All Claims program. Sorry for those of you attending that are hearing this again. I forgot to start the recording. We've had Jake Torrance introduce himself and Kwaku Wilson. They are both from Equity and Inclusion and provide information on that side. So now these are the acronyms we've used at each time. We just want to make sure they're on each slide deck so they're available to people. In case someone is watching this in the future and they're like, they keep talking about this, what does it mean? Hopefully they will be on this acronym sheet. This is also a slide that we've been using each of the times, but you'll see that I've actually added a bit to it. What happens after successful submission to APAC? So we have the and then. As a caveat, and I'm very glad that Kwaku is here today, but he's here as an expert. So he can answer questions probably, but one of the things that we found is that equity inclusion has a separate compliance law. We are going to try to remain in sync, just as we've done on the reporting end of it, the file layout, all of that. But we're in a slightly different place than equity and inclusion is right now. So we want to, we just want to acknowledge that we'll continue to collaborate, but we're at a slightly different point. So the focus today is compliance, and it's intended to be reassuring, which I admit isn't usually the purpose of discussing compliance. In the next two slides, I'll touch on what I see as the components of compliance for the All Payer All Claims program. And I do want to state that all of this information, anything being used for compliance in APAC, will be in our rule, whether it's the file layout that is incorporated by reference or some of the other requirements that we have that could potentially result in a civil penalty. It'll be in rule so that it's very clear, it's in writing, and as importantly, it'll go through the rulemaking process. So there'll be several opportunities to comment if something is unclear, if something uses a different terminology than you use and you think it'll be confusing, or if you just have concerns about whether or not it's practical. So it will be in writing through full rulemaking. Okay. I also want to acknowledge that our rules might hedge a little bit to incorporate sort of substantial compliance. And I want to, I just want to acknowledge that I'll give an example later on as we go, but I just want to acknowledge that this is a journey. This is something new for us. It's different than our other claims files that we're receiving, and we want to acknowledge that throughout the process. Okay, so I'm going to touch on the 4 different compliance factors, and then I will stop for discussion. So what are the factors? Who's asked? It's acceptable to have the head of household report for each family member. There should be a report for each family member, but one person could complete it. For adults and teens 16 and older, it's preferable to have them report for themselves, but we know that there are functional limitations on being able to send things to each of the individuals, as well as being able to track who's actually completing the piece of paper or logging onto a site. So we do not want it extracted from an electronic health record, though, and we'll go into that. Well, in the frequently asked questions, we go into the why of that. But for this purpose, we want to go to the source by the reporter. So reporter to source, moving information forward to us. So jumping forward, what is asked? Are the questions being asked as required? And this is absolutely essential. This is a survey. The survey and all of the terms around it are adopted by rule for equity and inclusion. So the questions need to be asked as created, the questions as stated, the order of the questions, and the potential responses must be specified. So this is probably one of the tightest requirements for compliance that we're going to have. Then we have 2 more aspects. When? This is an annual survey submitted to APAC quarterly. Our proposal is that the first survey would be sent within 30 days of enrollment. For CCO enrollment, the first survey is covered by the one system, and subsequent years, the CCOs will be sending to members. And then anyone who's non-responsive should receive at least 2 follow-ups to complete the survey. And the annual survey will be 1 year from the date the previous response is received. So if you send it to somebody in January, they reply in April. The following year, you should send it to them in March, April, May, and we will again get to that. And this is one of the examples of where our rules might hedge a little bit. If we say that we want it sent within 30 days of enrollment and you set it up to go out on the first of the month following the month they become a member, and the first month has 31 days, technically you would not be in compliance with 30 days. However, we're not concerned about that. And so we don't want people to worry about it. If you've got any questions about how you're going to set it up, then absolutely you can talk to us about it. But we're not planning on being that particular in the application. Similarly, if we make a rule that says follow-up should occur at 3 weeks and 6 weeks, and you set it up for 4 weeks and 8 weeks, probably not going to be a compliance issue for us. If you set it up to be the first of the following month, and then if no response has been received, the first of the subsequent month, and that's technically slightly more than 4 weeks and 8 weeks. Again, you're doing it on a regular process, you're doing it timely, that's not going to be an issue. If there's a miscommunication and we say 3 weeks and 6 weeks and you send it out at 3 months and 6 months, we're going to ask you to change that. As with all of our activity for APAC, there is a cure period for our civil compliance findings. So you would always have the opportunity to fix something before any dollar amount would be assessed for it. And then probably, yes, the follow-up requirements will also be in the rule language, so they will be very clear of what's expected. Chris, thank you for asking. And then probably our loosest and yet most important compliance factor is if the data is of poor quality, and that's whether it's people are non-responsive and you send out the reminders and they still don't give you any response, or they send in a response, either a paper survey that gets machine read or something logging onto a website, but all of their answers are declined to answer. We would ask the reporter to work with equity and inclusion to strengthen the data, and doing that through the messaging, telling people why it's important that we get this information, and trying to get better reporting both in the response rate and the response quality. But that is not going to be a point of you're not improving fast enough. That is simply a point of making use of the expertise at equity and inclusion to help us get stronger data. So this is...
Karen, sorry,
yes.
I see a hand raised by Curtis. Curtis, do you want to go?
Yeah, I don't know. Yeah, thank you. It's about what Karen's talking about. And I think we might have mentioned it last time on our previous session, but it's on the response rate, or in the APAC portal, we'll call it the threshold rate, right? Because that's how it's going to look for us. So are we going to have like a threshold rate in mind as we're getting this? Like, let's say we have 100,000 members we reach out to or whatnot. And at least 1% need to respond back. Like, is there going to be some hidden percentage in the background that we need to meet? Or is it just something that you understand you're going to work through with us?
So, Curtis, thank you for asking that question, because I actually have 2 answers to it. One is on the validation rule that you'd be talking about. The threshold is the validation rule. If we know that you have 100,000 members and you give us a file that has 10 members in it, it may well fail a threshold validation rule in the data portal for the purpose of saying, hey, you sent us 5 members. Please confirm that that's correct. And then you can say, yes, that's correct. That's the only people that sent it back to us in this quarter. And then the file would go forward. And that would not be a compliance issue. That would be let's check that the data we're receiving is correct threshold. When we put out the file layout for what's going to be for us Appendix J on REALD and SOGI information, we will indicate there what the error threshold is. Separately from that is compliance. If the first time you send it to us, out of 100,000, you've got 50 people that replied to you. And you're like, yes, we know that's only 50 people. That is correct. Then we're like, okay, great. We're taking that in. We're passing it through to equity and inclusion. And we're probably not going to really ask you to work too much with equity and inclusion at that point because you're just starting out. If after the 2 reminders, you only pick up 5 more, and then you send it out to additional people and you're getting a return of maybe 5%, at that point we may say, hey, we want you to start working with equity and inclusion on the messaging that's going out and seeing if there's any way that we can start strengthening this. But we'll probably be looking at doing that 6 months down the road, 9 months down the road. We know it's going to be a slow start. But I do want to distinguish between the validation rules in the portal that may well be triggered if a particularly small file is submitted to us, but are simply going to be for the purpose of validating we have received what you believe you are sending. And then compliance as far as, are you doing enough? As long as you are sending out the notices, you're sending out the reminders, you don't have to wait for us to say, hey, please work with equity and inclusion. You could initiate that contact yourself. Then, there's going to be it. And I see that Anna asked, is there a threshold? And the answer is not that we have yet, and probably not that we're going to have in the first year. After the first year, we, for anyone who's attending that isn't a routine member of our TAG meetings and doesn't routinely look at our file layouts, when we initiate a new field, we generally don't set up a error threshold the first year, depending on the type of file, because we want to see what's possible and then provide information. But for the purposes of compliance, again, if someone sends something in that's non-responsive, they send in a response, but it says, I'm not telling you anything. And you send us something that's like, okay, we got it back. They're not telling us anything, so we don't have anything to tell you. That is fully compliant on your part. We'd want to work with equity and inclusion because this is important information and we're hoping to change the member's mind, but you are compliant for providing that information through to us. After the first year, when we sort of see how things are going, then we might set up an error threshold. And even then, this is a different type of data file that we're going to be having. You have a contractual relationship with your providers. And if they're giving you poor data quality and we say, hey, this is poor data quality, you need to get better data quality from your providers. We want you to go to the provider and say, you have to improve A, B, and C so that we have better data. For Appendix J, for REALD and SOGI data, we do not want you to go back to the member and say, hey, you're getting us in trouble. You need to give us better data. This is voluntary data. You sending the data and submitting what you've got to us is compliance. There will not be a matter of you aren't getting good enough responses, because that's not the relationship we want you to have with your member about REALD and SOGI. And that's not the way we want to drag information out from people about REALD and SOGI. We want them to be comfortable reporting this information. Over the next few years, we'll have some alternative methods for people to submit. And it may be that we get a report back from Equity and Inclusion that say, hey, these 75 people logged onto our site and provided the information. So if they're not providing it to the insurer, we're still going to credit the insurer. Another area where this is going to come up is if people have 2 different kinds of insurance. Several of our insurers do dental and medical. We're only going to ask you to send the survey once. So one of your numbers will look really low initially, but then as we start looking at the resulting files from Equity and Inclusion and we load those into APAC, and we can give you back information that says, hey, 20% of your members are responding to REALD and SOGI questionnaires. And then a little bit later, we're like, oh, wow, you're up to 35%. This is great. Keep it going. Then that's going to be sort of the validation, but there's not going to be necessarily you have to get this many percentage, this many people telling you information to be able to be compliant with this requirement, because this is a different kind of file. And I
Karen,
see, oh,
yeah,
I see there's a hand up. Yeah.
Yeah, go ahead, Chris.
Oh, yeah, you had just mentioned a while back that you would work with us maybe on things like messaging. For CCOs, everything that we send to members has to be approved by OHA. Will there be boilerplate survey language for the CCOs that conforms to the reading requirements, whatnot?
I would certainly expect so, Chris. And we can work with Delivery Service Innovation Group, I believe, to make sure with the three of us, Equity Inclusion, APAC, and the group that works most closely with CCOs, to make sure that we're not asking you to do anything that violates your contract or your process with OHA.
And do you envision that by and large, since like OHA doesn't provide us with things like email addresses, that this would be, the workflow would be sending out a paper form, the member fills that back and we somehow convert that to data? What is your concept of how that workflow looks?
I am anticipating, initially at least, to have a lot of machine readable forms. And I know that's something that OHA has been working on, to have those forms available for people to use that can simply be scanned in. I mean, I don't mean that there's no coding behind it. There is going to be coding behind it. But the machine readable form is most likely the way to start. And not having email addresses is certainly going to be, a limitation. We can also work with equity and inclusion, probably not at the first point that something goes out, but within a few submissions, and hopefully by the second year, certainly. If they have a site where people could log on and do it electronically, or if you all want to create a site to collect the data electronically, where someone goes in and does a web survey, for instance, working on having a QR code that the person just scans and then can complete it online is also something that's completely appropriate. But I personally do anticipate some machine readable paper surveys as the first step. Do we have other questions in a queue?
Karen, this is Grace. No, we just had Curtis ask if we can repost the link for Appendix J, and that's been posted in the chat. And I see Antoinette has their hand up.
Yeah, hi. Not being, it is Antoinette from Cambia Health. Not being in the IT realm, but I am reporting back to my IT folks. Eventually, they will be part of the rulemaking. So you mentioned, anticipating a lot of like machine readable forms, and OHA is working to make that available. So does that mean that by the time rulemaking is done on the compliance piece, OHA would have the form available where we can also use for our members? Because you're saying that the questions, the order, everything is just going to be as passed by the OHA equity inclusion. So with this readable form, is that what's going to happen, where they will create a readable a machine readable form, and those required to report through APAC can take that and also for their members to fill it out. I'm probably not making sense, but
you are making sense. The machine readable form would be available to commercial carriers as well as CCOs. Anyone would be available to use it. It will need to be updated following the equity and inclusion rule changes and the adoption of the SOGI questions, but also some changes that they're making on race and ethnicity. And there may be other changes as well that I've lost track of. But those will need to be updated in the machine readable form, but it should be available before the end of the year and would be available to all.
Great. Thank you.
You are very welcome.
Karen, I see Chris has their hand up.
Yeah, I
Great,
just wanted to
Chris.
follow up on that machine readable
Mhm.
form concept because that's interesting. If OHA will be producing that form, is that correct?
I believe that HPA, our IDEA team, has been working on a machine readable form. I don't know if I'm assuming they're working with equity and inclusion on it. But I think that we're the ones that are doing that because equity and inclusion is doing a great many other things on this same topic. So yes, they would have that. There would need to be coding not only to read the form, but as we discussed in the last session, you're going to get a list of, if you use a machine readable form, you're going to get a form that has all of the races on it. And then you're going to be asked to pick those up, change them into their codes, and put them into a single field separated by tildes. So that would need to be part of the process, either at the machine reading state or after the data has been moved into a database and the file is being built. So there would still be work to do, certainly, but the base form should be available. If anyone is interested in doing a web-based form, I know that Equity and Inclusion has already worked on skip logic, and we would be expecting that skip logic to be applied as well. So how this will work with 8,000 languages, I don't know yet. So that's the big outstanding thing for me on the machine readable form. I am quite sure we do not list 8,000 potential languages on paper and ask people to fill in a little dot next to the ones that they speak. So we will have to see on that. But fortunately, this again, very early discussion. We've got months to work on that. So, and I do want to remind people, if nothing else, be sure you attend the July TAG meeting. We will be going over REALD and SOGI in more depth, including the updated version of Appendix G. Updated from the draft that's currently available online. So are there other sort of general questions about what I've picked out as potential compliance factors?
Yeah,
Yes.
one more question, Karen. So you did mention that, for example, if a commercial or CCO insurer also, does dental and medical, one submission for that one individual will be sufficient. For example, if that individual also has those products through the same insurer or CCO. Another question I just wanted to clarify, those products that are in scope, so it's medical, dental, and Medicare supplement. And I think some others, I mean, we don't do that. But go
Medicare
ahead.
Advantage.
And Medicare Advantage?
Yes, not Medicare Supplement, Medicare Advantage.
But in looking at the rules, it's scoped in Medicare Supplement, Medigap as well.
In the equity and inclusion rules?
Yes.
Okay. Then we would certainly be willing to accept those and pass them through for it. Yeah.
Yeah, because I was just reading the law, because I had to just make sure those products that were in scope with the products that we issue, that we knew what they are, so that we made sure that they hit every line. But yeah, Medicare Supplement is in scope.
Terrific.
In the law. Yeah. Okay.
Okay. Yeah, we'll work with equity and inclusion about including those. But we will be able to report out of APAC on commercial, Medicaid, and Medicare Advantage. So, Chris.
Yeah, I got another question. Just thinking
Good.
through this, and I don't know if this is something, but this information, like if we were to mail somebody a letter and they were to fill that out and send it back, we don't know they actually filled it out, right? Anybody could have filled out that survey and sent it back. And so I wonder if, without having to have a full-blown provider portal, would it be sufficient to say, direct the member to log in, put in their personal ID or the personal information, complete the form, submit it, and then we try to match it to the member after the fact to make sure it's legit? would that, would there be any compliance issues around that? And I wonder if this information technically counts as PHI.
Well, dealing with the last statement first, because you're asking the survey, not you, the survey asks about disability status. I would think that we should count this as personal health information. So all of the requirements for security around that should apply to this as well. As far as having an extra step where someone uses information that's only known to them in order to log on, I'm going to defer to equity inclusion on that. For APAC, I don't see an issue with that. Certainly, we have an interest in having it be an electronic survey that has some advantages for the member in filling it out. I don't have a particular concern about are they the right person. Certainly, a 16-year-old, a 17-year-old who is questioning anything related to SOGI information may or may not have spoken to the head of household about that. And if the head of household is filling out a form for that individual, they may be going cisgender all the way down. And that's the best information that's available to us at this time. And that is, acceptable. But Jake or Kwaku, do you guys have any initial, and we can certainly put this into our frequently asked questions, which I had hoped to have out by today's meeting, and now I'm hoping to have out within the next couple of weeks, because I'm sure it's not a surprise to you all that some of the questions are pretty straightforward and concrete, and a lot of them have a lot of policy implications and a lot of activity implications that we want to make sure we understand before we publish the proposed answers. But as far as having the member log on, any questions or concerns, Kwaku and Jake?
Yeah, I'd have to oh, Kwaku, go ahead. There you go.
Go ahead, Jake. Go ahead.
Well, I was going to say I defer to Kwaku on that. I think, if you get in the business of, having to match people, I'm sure everyone knows how difficult that can be. So as long as it's a kind of one-to-one correspondence of, who's filling out the survey as opposed to, somebody's filling out their nickname as opposed to their real name, I don't see any issues with it. But again, totally defer to Kwaku on that.
I agree. I think we know that different systems will use different ways, but insofar as there is some consistency and you can validate these things, I think that will be the more important part of this first.
At least for CCOs, I would assume like their Medicaid ID would be a primary, maybe Medicaid ID, date of birth. Obviously, not everybody's going to have a social security number, but it feels like if we can ask the individual to provide those elements without giving them confirmation, perhaps that matches to an individual, allow them to fill out the survey and then match that on the back end and then send correspondence, to those individuals that have yet to come to our website or whatever to complete that survey seems like a workable solution.
Yeah.
Okay, I'm seeing a lot of head nods. So. All right, so again, talking about APAC exclusively, I just want to reiterate that if requests are not being sent at all, a civil penalty through APAC is a possibility, but the 30-day notice to cure will apply to Appendix J, REALD, and SOGI information, as well as everything else we do. If you can document that you're sending, but people are largely non-responsive, then we'll ask you to work with equity and inclusion. We've got our resources list and then questions and comments. So again, I don't want anyone to feel like they're asking too many questions. Everyone is very welcome to ask questions. And if you've got a question and you've already asked 3 questions, ask a 4th question, ask a 5th question. Just let's understand what you need from us to be able to do a good job with this and start doing some brainstorming about what would be available to help with. Curtis.
I got it. Yep, I got a question. So I'm looking at the current draft, right, of Appendix J, right? So we say Appendix J, but it seems there's 4 parts to this. So is it just the one file, right? The one file that you'll be getting from us, or is it 4 different Appendix J1, J2, J3? I just
No,
wanted to get a total count if I'm understanding that.
Right. It's a single standalone file, which is why you're giving us all the names and information as well as the responses to the REALD and SOGI survey information in a single data file. The J1, J2, J3 are lookup tables to be used in Appendix J when you are interpreting literals that may appear on a machine readable form into the code that's actually submitted in the file layout.
Okay, so generally speaking, Appendix J, right, that I'm looking on the first screen, right? That's basically the layout in a sense of what we're trying to go for. Am I understanding that right?
That is the intention, yes. And
Okay.
this was based on last year's REALD and the SOGI information that they were collecting from hospitals during COVID. So there will be changes based on the rulemaking that is being completed at Equity Inclusion. So.
Okay, and I think earlier you said this. So was it next month you're gonna finalization on certain parts? Is that what was mentioned?
Next month we will have, because of rulemaking, I'm going to call it a final draft. We'll have a final draft of Appendix J. And then Grace, as the project manager for all of our REALD and SOGI implementation activities, will initiate rulemaking in APAC for the adoption of Appendix J and probably a new rule specific to data collection and compliance for this.
Thank you. And then lastly, is that a public meeting that I can attend, or is that I'm on the OHA website looking at work groups. So like which one would this fall in?
This would be in July, it'd be our technical advisory group, our TAG group. That is considered to be a public meeting. Anyone can attend.
All righty. Thank you so much.
Okay. Antoinette.
Yeah, so quick question then. So for the rulemaking, am I hearing that you're not going to have like a rule advisory committee? But you
we will.
Oh, okay. So what was the technical advisory group that you were talking about?
In July, for our technical advisory group, Grace is going to be presenting on the current status of the REALD and SOGI implementation project, including we'll go over Appendix J as proposed. Then we will start formal rulemaking, including having a rule advisory committee. And actually what we usually have is a rule advisory committee that is non-compliant with state law, because we generally don't have really members of the public attend our rule advisory committees, and we don't really have a way to reach out to them. It's generally industry and researchers that attend our rulemaking activities. But we will have the full meeting for that to review it, get comments on it. There will be an open comment period. We'll finalize things with the Secretary of State's office. So we'll do the full rulemaking process, and it will be a public process. We just generally don't have members of the public participate. And we might get some interest in this, and we could work with Equity Inclusion to see if they have people that have been in their rulemaking that would be interested in ours as well. Although I'm hoping the interest is slight, only because we're going to try to match what Equity Inclusion has done to the greatest extent possible. So maybe we can have some people attend just to make sure we're matching correctly and we're not misunderstanding. But we're trying to take what Equity Inclusion has done, tweak it a little bit for the more IT needs of insurers, our field, as opposed to community groups and providers filling it out individually. But other than that, it really should match what Equity Inclusion is doing. But it will be a separate rulemaking process, comments, the whole shebang.
Okay, so for the RAC, again, I'm still not clear about how members would be chosen. I know it would not involve the public at large, but it would mostly, you know, industry. So
Yeah.
if we're interested in being on the RAC, do we reach out to you to let you know? And then for the technical advisory group 2, I'm assuming that those that have been regularly attending your sessions will be kept in the loop as to when it is, so that we can also attend.
Yes, that both correct on both points. And Antoinette, I have to say that unlike some groups in OHA, the interest in APAC has not been so great that we have had to exclude anyone from a rural advisory committee because we just have too many people who are interested. We usually are able to accommodate anyone that has an interest in being a formal part of the process.
Okay, great.
Yeah.
Thank you.
But we will be involving the tag in that process. So anyone who routinely gets our tag information, anyone who routinely has information, gets information when we update the data submitter webpage, we will also be sending out notices to that group that says, hey, this is what we're doing, this is what we're proposing, here's where you can find more information, and you're welcome to join us as of this date and time, as well as this is the date and time to submit written comments.
Perfect. Thank you.
Sure. Yeah, it's my 2 rulemaking experiences with the state have been Vital Records or Center for Health Statistics, and now All Payer All Claims. Neither of them have had such overwhelming interest that we've had to turn people away from being able to do live comments on rulemaking.
Got it.
So any other questions today? So just to sort of touch on next steps, the most immediate next step will be to post this recording and also to get the frequently asked questions out to date. We do expect those to be sort of a moving target as additional questions come in, but those will be posted, as will the recording, on the web page for this implementation project. And we'll take questions as we've got on the last slide, which you're not seeing anymore, but at APAC admin at odhsoha.oregon.gov. We're happy to get questions anytime. So if you think of a question you forgot to ask, you don't have to wait for the next meeting or public thing. Just send it in. We'll respond to you. If we think it's a question everyone would want to know the answer, or 10 people would want to know the answer to, we'll add it to the frequently asked questions and keep those moving and updated. We will be talking to TAG to give them an update in July. We'll be doing formal rulemaking. And then as we think we know what the rulemaking is going to look like, and Grace, would you drop that in the chat? Thank you. If once we think we know what the file is going to look like, what compliance is going to look like, then we can schedule additional development meetings that people have said they think would be useful to them after they've got a firmer grasp on what's being expected of them. We're happy to do those. So I think that that's sort of what we're looking at over the next few months. We know that this pre-planning, hopefully it has been useful, but so much is squishy that as we start getting things a little bit more concrete, we're expecting a whole new crop of questions, and we'd be happy to receive those. Chris.
I'm just doing what I'm told. I think I'm on my 4th question here. So, but I just wanted to, I was looking at the web page here with this, all these links, these meetings were posted. And I'm curious if the slide decks could be posted there as well, because the recordings are, but not the slide decks.
Yes, Grace has nodded that we can do that.
Awesome. And then I was curious if there's anybody from like the CCO side of OHA attending this meeting, or if this will be brought to those CCO specific work groups eventually, because I don't think that's been brought to those work groups yet.
Okay, so if you mean our tag meeting, we do have some people that attend that have CCO arms. Pacific Source is an example. that they generally have someone there. And we are happy to meet with any other CCO focused group that would be interested in giving us some time. So,
And I was thinking more specifically, OHA staff, like that interface more with CCOs that might be the bridge between these two programs.
okay, we will have some meetings with them as well to make sure that they know this is going on and to pull them in. We have shared the information with a couple of people, but not really in a systemic way. So as we move to this next step, it probably is a good time to give them a status update. This is where we are. Invite them to meet with us if they have questions as well, and start that heavier coordination as far as boilerplate for contacting members about submitting the REALD and SOGI survey information. That's a good suggestion. Thank you. Anything else today? So I also want to invite Grace, Kwaku, and Jake to share any information that they want to add.
I'll just say many thanks. This is meeting number 4, I believe. And, I remember when we first started this meeting, I feel like I wasn't aware as many of the problems we might run into. So again, thanks for everyone from each CCO, each insurer sharing kind of their insights, because we're taking all this information and understanding how we can better do this for everyone involved.
I agree, and just want to thank the APAC team for your collaboration on this. We sincerely appreciate you, and for everyone who's participated in these sessions.
Yeah, we certainly wanted to be. Oh, go ahead, Grace.
No, sorry. I'm just responding to Curtis's chats here, kind of laying out the purpose for next month's tag meetings. I hope that will be helpful for everyone. When are we expecting to see the guidelines?
So as far as Appendix J for APAC goes, we hope to have a final draft available mid-month, July, and then rulemaking will start. And I believe Grace has put into the chat information about how to make sure you're notified of the rulemaking if people want to be involved in that, or just receiving the documents. Again, everyone is welcome. And I will also want to thank, Appendix J will have REALD and SOGI in a single file for it.
So Karen, Grace, I'm just follow up on my question. So are we looking for a final layout in August then? Is that what's because we're asking questions and getting an idea of what the expectation of this is, but we don't have anything final to get up and go on, at least start work on.
That's correct. You don't have anything final from us. So
gotcha.
Because our file layouts are incorporated by rule, it will not be final until rulemaking is complete. That's when we will refer to Appendix J as final. We will be updating Appendix J to match the new requirements for REALD SOGI by mid-July. And that's going to be pretty certain because, again, we're doing everything we can to match equity inclusion, and their rules are final. So we're waiting for their rules to be final, then we initiate ours to make sure that we're not out of sync. But because of rulemaking in Oregon and the fact that our appendices, our file layouts are incorporated in rule, I won't be referring to them as final until rulemaking is final. So it's a little bit of geeky language going.
Okay, yeah, thank you. I just need to know when.
Yeah.
That's my question, and I understand
Yes.
things go through multiple revisions. It's just if I need to report it back to my people about hey, this is what's going on, we're doing a re-revision next month and this is going to happen, and then we'll follow up. I just want to make sure I understand correctly what's going on. So
Yeah.
Thank you.
You're welcome. And the questionnaire, the questions to be asked, the order to be asked, all of that is going to be taken from Equity and Inclusion's rules. We will need to update the machine readable form to their current rules, their new rules. But that's going to be based on their rules. We will not be making separate rules about what the questions are. We will simply be referencing Equity and Inclusion's survey for it. And then we'll have a file layout on how to report the information gathered through that survey to APAC to be passed forward to Equity and Inclusion. And hopefully that makes sense to people. But we can also put it in a frequently asked question if you'd like to see it in writing, because it is a little complicated. It's multi-stage. So.
Yeah, thanks, Karen. I think, yeah, these work group meetings are very much pre-planning meetings for us. We're still very much deep in the process of rules advisory committees and finalizing rules and appendix file layouts for everyone. So like we've said, we're thinking the RAC hearing will be in the fall, August or September, with rules being finalized sometime in the fall as well. So we're thinking November, just so everyone has ample time to get ready for the submission date. We're thinking July 2025, July 31st, 2025.
And we will likely have that date in our rule. Something like
yes,
beginning July 31st, 2025, quarterly reporting. Yeah. Any other questions, comments? These have been very helpful for us in trying to understand what we can do to help actually implement this. Clarity is a big one. Having things written down so that you can really count on this is the way it's going to be before you start taking action is certainly a big one for that. But we hope they've also been useful to you all to start understanding what you need to do, whether it's infrastructure, communication. Do you want to rely on a template for communicating with members? We can work with you on that, all those kinds of things. Hopefully this has helped you start thinking about what you want to have. But yeah, we know that this is very early. Okay, so last call for any other questions today.
I see someone asking if there's a way to access the slides that are presented today. So this recording will be posted on the APAC REALD SOGI implementation website, and we'll also go ahead and attach slides for today's meeting and the previous meetings as well.
Okay. Well, thank you all. Yes, we can all take the last 6 minutes before, at least on our side, lunch starts. But 3 o'clock, I guess, on the East Coast. Thank you all. These have really been helpful to us, and greatly appreciate people participating. The ones that are listening, the ones that are asking questions, all of you have added value. So thank you. Okay, bye.
Thanks, everyone.
Thanks, everyone.
Bye-bye.
Bye-bye. Thanks.